Hi everybody, welcome to Beauty Buzz with Lori. So today we're going to be talking about melasma, treatments for melasma to be specific. So melasma is a very difficult condition to treat. As a matter of fact, it's a chronic condition that has no cure. So whenever we talk about treating melasma, what we want to refer to is some topicals as well as in-office procedures. So your number one line of defense is going to be sunblock. So I can't stress this enough. We live in Florida. There are other areas in the Sun Belt that you also are going to have this problem because heat also stimulates melanocytes, which produce melanin in your skin. So with that said, you want a physical sunblock. Melasma patients should never be wearing chemical sunblocks. It should always be a physical. I know you guys have heard me say this ad nauseum, but it is the truth. So in your active ingredients, what equates to a physical sunblock is zinc oxide, titanium dioxide, or iron oxide. So these are all minerals that sit on the surface of the skin and help to basically reflect the UVA, UVB rays. So there are also some sunblocks out there like our Zeo Skin Health Sunblock, our Broad Spectrum 50, as well as our Sunscreen Plus Primer that are perfect sunscreens for melasma because what they do is they also protect you against high energy visible light as well as IRAs, which is that blue light that you have on your computers, your phones. Again, you've heard me talk about this as well in some of my past videos. This is very important. So that's your number one treatment option, is you want to get on a good sunblock. The second thing you're going to want to look into is a topical retinoid. Topicals are great in helping to get that pigmentation under control. Remember, we are not curing melasma, we're just trying to get it to a manageable position so that we can move forward and you don't have to, be upset every time you look in the mirror at that, also known as the pregnancy mask. I like to start you out on 0.5% of the Retin-A, which is prescription, and that's tretinoin, which is what we use here in the office. And then from there, we do about 8 to 12 weeks. I take before photos and I bring you back and we see what kind of lightening we've gotten in that pigmentation. And then from there, we decide maybe if we need to move forward with some in-office procedures. So some of those in-office procedures might look like microneedling, chemical peels, and then we actually might use a combination therapy of topicals with the microneedling and the chemical peels as well. If you have melasma and you're struggling with this, I want you to come in. I want to sit and talk with you. Let's talk about what your lifestyle is. Do you spend a lot of time outside? There's many things within your lifestyle that might actually help us choose our course of treatment that we would move forward with in order to help you get that melasma under control. So again, melasma, your first line of defense is going to be that sunblock. And then from there, call us and make an appointment. Come in and see me, and I am happy to be on this journey with you and getting your melasma under control. We have a couple of girls here in the office that struggle with this as well, and it is a constant working in progress. So don't feel like you're alone with this. We've had plenty of experience with it, and we're happy to be on this journey with you.